Okay, hey class. So for my abnormal gait pattern, I chose the Trendelenburg gait, and this is characterized as a patient that has unilateral weak abductor muscle weakness. So a way to diagnose this is if the patient is walking and when they put their weight on their weak side where they have less strength in their abductor muscles, their contralateral side is going to drop excessively. So their walk is going to seem kind of like a limping pattern because that other side is trying to compensate for the muscle weakness. A variation of this gait pattern would be a bilateral weakness in the abductor muscles, meaning both sides. So when the patient is walking, it's going to be more of a wobbling pattern when their hip is dropping excessively, when both of the weak sides are not able to really abduct, and so they're not finding their center of gravity, so both sides are going to be dropping excessively. So causes of this abnormal gait pattern is obviously a weak abductor muscle group as well as a weak glute medius, and then another possible cause is going to be an injury to the superior gluteal nerve, which supplies those muscles. So if that nerve is injured, those muscles are going to not function properly as a result. So another very common cause of this is going to be patients that are recovering from hip replacement surgery. So from their surgery, there's commonly a avulsion abductor muscle tendon. So that's going to definitely have an impact on their gait and on the abductor muscles function. So methods and ways to help these patients. First, a doctor may suggest using a lift, which is just like a elevated heel little platform to be placed in their shoe, and it'll help them compensate, and that way that the foot will have a shorter distance traveling to the ground, so it'll help those weak abductor muscles that they have. And then the next phase of restoration that they can go to is obviously physical therapy, and physical therapists use osteopathic manipulative treatment for this most commonly, and that's going to have the physical therapist move the patient's muscles and joints and different techniques and ways that include stretching and gentle pressure and force resistance, so that those muscles can become stronger and that they can be more like accustomed to those movements, so that they can move more easily and it's less noticeable when they limp, and or if they have bilateral weakness when they wobble.